Let's be honest, who has not stayed at the Monday alarm and thought, what if I just did not? The bed's warm, the world's cold, and emails can vanish for all you care. Adulting feels like a scam, and your blanket cocoon is offering full asylum. But here's the twist. A lazy day here, and there is self-care, but make it a habit, and your body turns into a horror movie, starring your own organs as the villains. Forget your boss now, your muscles, bones, and lungs are staging a mutiny. And with 43% of Americans too tired to function, we're all just one binge away from becoming the star of our own slow-motion health meltdown. The fantasy begins. At first, everything seems perfect. You've got your snacks, your podcasts, maybe a tablet propped up playing your favorite show on an endless loop. It's like winning the laziness lottery. You don't have to worry about commuting, dressing up, or dealing with Greg from accounting. However, while your mind basks in this utopia, your body is already plotting its revenge. The lungs start complaining. By the time you hit the 24-hour mark of non-stop bed rest, something odd starts happening inside your chest. Thanks to gravity, or rather, the lack of its usual pull when you are lying flat. The lower portions of your lungs begin to collapse like deflating balloons. This collapse isn't dramatic enough for you to feel right away, but it sets off a domino effect. Normally, mucus has highways to travel along in your lungs. But with these passages partially collapsed, mucus starts getting stuck like a car in a traffic jam during rush hour. Trapped mucus becomes a breeding ground for bacteria, raising your risk of lung infections, particularly pneumonia. That's why hospitals encourage bedridden patients to sit up and cough regularly to give those lungs a fighting chance. Unfortunately, when you are deeply invested in that true crime podcast binge, who has time for coughing exercises? And that's how trouble begins. The Great Muscle and Bone Rebellion. After about a week of horizontal living, your muscles and bones decide that if you're not going to use them, they're not going to stick around. It's like your body is having a clearance sale on strength. You start losing about 1% of your bone density every week, especially in load-bearing areas like your hips, spine, and legs. This bone loss makes your skeleton increasingly brittle, turning even minor bumps into fracture risks. Astronauts, who float in zero gravity for months, face a similar problem, only they have strict exercise regimens and calcium-rich diets to counteract it. Netflix marathons don't count as exercise. Meanwhile, your muscles, especially in your thighs, butt, and shoulders, start melting away like ice cream on a hot day. Within a week, you lose 1% of your muscle mass. And it gets worse. Muscles play a key role in managing your blood sugar. Under normal circumstances, they absorb sugar from your blood to fuel movement. But when you stop moving, your muscles stop absorbing sugar efficiently, causing glucose to build up in your bloodstream. This sluggish sugar clearance can eventually lead to type 2 diabetes. Congratulations, your lazy vacation now comes with chronic disease risk. Bed sores enter the scene. By the second week, things start getting even grosser. Enter bedsores, also known by their fancier name, pressure ulcers. Bedsores develop when the same areas of your body, think hips, tailbone, heels, and ankles, are pressed against the bed without relief for extended periods. The constant pressure chokes off blood supply to these areas, killing skin cells and opening wounds that can tunnel down to the bone. Yes, literally exposing your muscles and bones. Not exactly the pampering you were picturing, huh? That's why hospital staff diligently reposition bedbound patients every couple of hours to keep these ghastly wounds from forming. The heart gets lazy too. By now, your muscles are wasting away at an accelerated pace. After a month, you've already lost about 10% of your muscle mass. With less muscle tissue, your body does not need as much oxygen, which means your heart doesn't have to work as hard. In response, your heart starts slacking off too, pumping 30% less blood per beat. The irony? Even though you are resting 24/7, you feel more tired than before, because your body's oxygen and nutrient delivery system has slowed down dramatically. Now, even sitting up feels like you've run a marathon. Total system breakdown. By month 6 of your self-imposed bedathon, your body has basically turned into a biological horror show. Your bones, about as sturdy as breadsticks, your muscles, vanished like your motivation. Your heart, pumping with all the enthusiasm of a tired sloth. Your lungs, wheezing like a broken accordion. Your skin, a battlefield of nasty, painful bedsores. At this point, even thinking about standing up feels like signing up for a high-risk stunt show, as your fragile skeleton wobbles under the slightest pressure, and your heart panics at the mere idea of movement. Congratulations, you have officially become allergic to gravity. The mental health meltdown. We have covered the physical train wreck, but let's not forget what's happening upstairs in your mind. At first, being isolated in bed with endless entertainment might feel like a blissful escape from responsibilities. But as the days turn into weeks and weeks into months, your brain starts suffering from sensory and social deprivation. Staring at the same ceiling fan and listening to the same playlists becomes maddening. Your brain craves stimulation, variety, and human interaction. Studies show that extended bed rest can increase the risk of anxiety, depression, and feelings of imprisonment. One study conducted on pregnant women prescribed bed rest found heightened levels of emotional distress, helplessness, and depression. And these were otherwise healthy women simply trying to protect their pregnancies. Now imagine adding 6 months of physical deterioration to the mix. We were built to move. Humans evolved to move. Our ancestors didn't have plush mattresses or remote controls. They walked, ran, climbed, and hunted. Movement is wired into our biology. Every major system in your body, muscles, bones, heart, lungs, and even your brain depends on regular activity to stay functional. Doctors know this all too well, which is why modern hospitals emphasize early mobilization for patients. The sooner someone can get out of bed post-surgery or illness, the better their long-term outcome. Hospital staff often help reposition immobile patients every 2 hours, encourage passive range of motion exercises, and implement physical therapy routines even while patients remain confined to bed. The myth of rest equals recovery. It's easy to believe that more rest equals better recovery, but that's not always true. While short-term rest can be crucial for healing, after certain injuries or surgeries, prolonged inactivity becomes its own health risk very quickly. The balance between rest and movement is delicate and crucial. Even on your laziest Sundays, your body still expects you to eventually get up, stretch, take a walk, or even just fidget in your chair. These small movements keep blood circulating, maintain muscle tone, and prevent those nightmarish consequences we've just described. Enjoy lazy days, but respect your body. There's absolutely nothing wrong with indulging in a lazy Sunday lounging in bed, sipping coffee, and binging your favorite shows like a professional couch potato. Your brain loves a little downtime after all. But turning that into a full-time lifestyle, that's less of a vacation and more of a full-blown science fiction disaster where your own body becomes the villain. Your lungs crave gravity, your muscles beg for movement, your bones scream for pressure, your heart needs to hustle, and your brain's dying for some fresh stimulation. Basically, your bed is like that one friend who's great for a short visit, but totally unbearable as a long-term roommate. So by all means, savor your naps, just make sure you stand up before your body files a formal complaint. And there you have it, proof that your bed might secretly be plotting against you. If you enjoyed this deep dive into the dangers of eternal laziness, smash that like button, hit subscribe for more oddly terrifying science, and don't forget to ring the bell so you never miss a video that might just save your life or at least get you out of bed.